Really nice to be with you all today. And again, thanks for giving us the opportunity to share with you all the work that we've done. And we're really grateful to Wage Indicator for also this collaboration, sharing data with us. And we look forward to discussions with the audience. So I'll go through a little bit of a background just to give context for why we got into this work. And Nyla will actually go through the research that we did, and then Chioma will walk us through what we've done with the research and what are kind of our way forward. But just to introduce GAIN, if some of you don't know who we are, GAIN is a nutrition foundation. We were founded by the United Nations in 2002 to tackle the human suffering caused by malnutrition. And we're driven by a vision of healthier diets for all people, especially the most vulnerable. And we do this through improving food systems. Thanks. So I'll just get us kicked started a little bit. I'm not sure how many of you are familiar with the global nutrition context. But basically the burden of malnutrition in the world is quite large. At least 1 in 3 people suffer from some form of malnutrition. It comes in the form of overweight, obesity, which are often considered overnutrition, of whom there's about almost probably 3.5 billion people who suffer from this. At the same time, we have undernutrition or chronic hunger, which still affects about almost 500 million people. And then interestingly, we have something called hidden hunger, which is micronutrient malnutrition, but about half the population in the world does not consume enough micronutrients. And so we have about 2 billion people who suffer from some form of micronutrient deficiency, the most common one being anemia. So as you can tell, most of us on the planet need a little bit of help with food and appropriate diets to meet kind of all of our nutritional needs. So GAIN realized that, in trying to address the burden of nutrition in the world, there is an important and relatively untapped opportunity to address this through working through workplaces and employers. And this is because we know the majority of the adult working population is employed or informally or formally, but spends about a third of their time at work. And this means that they're also consuming food at this time. And in some workplaces and work contexts, as much as 60% of people's calories and food intake happens during working hours, at least 30% and sometimes up to 60%. And so when you think about the entire global working population, which actually we'd love your statistics on this, but we understand is up to 3.4 billion people, workplaces really offer an incredible opportunity to influence diets and hopefully improve them to address some of these malnutrition issues in the world. Next slide. And workplace diets are also linked to productivity and health, disability, and even death. We know that poor diets weaken immune systems, impair cognitive functions, and is the second largest cause of non-communicable diseases in the world. And NCDs are the rising kind of concern of diseases in the world as opposed to infectious diseases. Aside from tobacco, poor diets are leading basically the causes of NCDs. And this costs billions of dollars in lost productivity for businesses and lower wages and incomes for workers. But it's basically those who suffer from NCDs or reduced immune systems all affects our health and our ability to work. And probably more importantly, NCDs are also the leading cause of death and work-related illness in the world. So all this to say that addressing diets is important. It affects all of us. It affects workers. It affects employers and governments. So recently we've been working with the ILO to consider how well occupational safety and health regulations and policies um, integrate nutrition into some of the policies that exist, and it's not as much as we think. Part of that work, we also wanted to look at the perspectives of workers, and for that reason, we looked into collective bargaining agreements. And we wanted to understand the same thing. To what degree do collective bargaining agreements discuss and cover nutrition? Is this a topic that's material for workers? Are they interested in nutrition? Are people aware of the issues of this burden of malnutrition? So that's what got us kick-started on looking at collective bargaining agreements and nutrition. So with that, I'll hand over to Nyla, who will talk a little bit about the research that was conducted.
Yeah, as Christina has highlighted the importance of nutrition in the workplace, we wanted to explore whether nutrition is already being recognized as part of protecting workers' health. So one way to examine this is through collective bargaining agreements, or CBAs. CBAs are written agreements between employers and workers to set out employment terms or working conditions. And we choose CBAs because they are an important mechanism for shaping workplace policies. However, their role as a tool for health promotions remains relatively under research. Therefore, our study aimed to explore the extent to which collective agreements from all around the world include clauses related to worker nutrition. So to conduct this study, we first carried out web-based and bibliographic search to identify relevant CBA database. In total, we found 1 global database, 6 national database, and 1 sector-specific database. And after applying our selection criteria, retain 3 databases for the analysis. First is the WageIndicator, second is LaGiFrance, and the US OPM. Together, this contain more than 26,000 CBAs. So for the WageIndicator database, it was analyzed using pre-coded variables, while LaGiFrance and US OPM were analyzed using keyword search. So it is important to note that there may be some overlap because WageIndicator also includes agreements from France and the United States. And for the analysis, we group our search terms into 2 categories. So first is the direct nutrition reference, meaning clauses that explicitly mention nutrition, such as healthy meal or balanced diet. And the second category was indirect nutrition-related provisions. These are clauses that may support nutrition outcomes, but do not explicitly mention nutrition, such as meal allowance or meal breaks. Yeah, to define workforce nutrition, we use the workforce nutrition pillars developed by GAIN as our analytical framework. And the first pillar is healthy food at work, which focus on improving access to healthy and nutritious food through canteens, healthy snack offerings, or related initiatives. And then the second pillar is breastfeeding support, which includes all measurements to help mothers to continue breastfeed, such as maternity leave, lactation rooms, flexible working arrangement, and awareness initiatives. And for the third pillar is nutrition-focused health checks, which involve assessing nutrition-related health risks through screenings, nutrition counseling, and follow-up support. And last is nutrition education, which aims to improve knowledge and skills that help employees to make healthier diets and lifestyle choices. So these 4 pillars guided our definition of workforce nutrition throughout the study. Yeah, so this slide represent the overall research results across the 3 databases. So at the top, you can see the total number of CBAs screened from each database. And the lower sections shows the total number of mentions identified for all nutrition-related variables and keywords included in analysis. And the key finding here is that direct nutrition reference were relatively rare across all the database, and in contrast, indirect nutrition-related provisions appeared much more frequently. Yeah, and this slide provides a closer look at selected keywords and variables from our analysis. We purposely selected these examples to illustrate the contrast between direct and indirect nutrition-related provisions. And the white rows represent direct nutrition reference, while the yellow represents indirect nutrition-related provisions. So overall, direct nutrition reference appeared much less frequently than indirect nutrition related provisions. So most direct nutrition reference receive very limited attention. For example, here, the term nutrition appeared in less than half a percent of agreement in LagyFriend's database. And similarly, such terms such as balanced meal, balanced diet, and breastfeeding break did not appear at all in the US OPM database. However, if you see here, breastfeeding support was an exception for the breastfeeding support pillar, because in the wage indicator database, about 80% of CBAs included clauses on breastfeeding breaks or facilities. And even around 11% specifically stated that these breaks were paid. And lastly, although explicit nutrition reference were uncommon, several indirect nutrition-related provisions were frequently included. For example, more than 84% in the CBA's wage indicator database contain health or medical assistance for employees, and nearly half included maternity leave provisions. Yeah. When we compare the four workforce nutrition pillars, breastfeeding support emerged as the pillar receiving the greatest attention across CBAs. And in contrast, nutrition education was the least represented pillar, with very few agreements containing explicit reference to nutrition education initiatives. And this suggests that workforce nutrition is most commonly addressed through maternal health-related provisions rather than through broader nutrition promotion activities. Yeah. So in addition to the quantitative analysis, we also conducted a qualitative review of selected CBAs that contain nutrition-related content. So we selected examples from different WHO regions and different industries to illustrate the range of provisions we identified. So, for example, here we have a collective agreement from textiles industry in Indonesia that explicitly stated that meals provided to workers should be healthy and nutritious, and even they mentioned explicitly that it should be aligned with the health standards. So this is a very good example of how direct nutrition reference in within a CBA. And for breastfeeding support, a collective agreement from the transport sector in Kenya included provisions for paid maternity leave and guaranteed that workers will not lose employment privilege while on leave. I think although these clauses do not explicitly mention nutrition, but they support breastfeeding and maternal health outcomes indirectly. Yeah. This is from the United States, a healthcare sector agreement included preventive health screenings for conditions such as anemia, blood cholesterol level, and diabetes. This illustrates like how nutrition can be addressed through workplace health checks. And lastly, a collective agreement from the mining sector in France referred to nutrition as a part of health advice and workplace training activities. This demonstrates how nutrition can also be integrated into employee education and awareness program. Yeah, and these are three key takeaways. So first, direct reference to nutrition in CBAs remain rare. And the second is nutrition-related provisions such as meal allowance, maternity leave, and health support are much more common. And third is breastfeeding support is the workforce nutrition pillar that most frequently addressed across agreements. So together, these findings suggest that nutrition is already presented in many agreements, but often in implicit way rather than explicit way. Like any study, this research has both strengths and limitations. One of the key strengths is that, to our knowledge, this is the first study to specifically examine nutrition in collective agreements. And another strength is our collaboration with the Wage Indicator, which we are very much grateful for, because this collaboration enabled us to analyze this across cross database analysis. And in addition, our use of both direct and indirect nutrition-related search terms allowed us to identify not only existing nutrition provisions, but also opportunities for strengthening nutrition integration in CPAs. However, there are also some limitations. So for some database, we could not include them because of access restrictions or limited search functionality, and also because our analysis relied on keyword search, we may have missed some relevant clauses or capture clauses that were not directly relevant. And lastly, the language difference and translation challenge may have affected our interpretation of some agreements. And for future research recommendations, looking ahead, future research could expand to more countries and language and compare results across sectors and regions, and then incorporate qualitative methods to complement the quantitative, and then track how nutrition provisions evolve around time. I think with that, I will hand over to Chioma. Thank you.
Thank you very much, Naila. Now we're going to focus on what is the way forward. Yes. So like Naila and Christina has mentioned, that the collective bargaining agreement is very critical to improving both the nutrition and health well-being of workers. From Naila's presentation, we see that the direct nutrition references in the collective bargaining agreements that we analyzed are very limited, while the indirect references are well represented. However, this is our recommendation. We want to recommend positioning nutrition as the workplace and workers' rights issue. And how do we do that? We do that when we explicitly integrate nutrition provisions into policy agreements, such as the collective bargaining agreement. And for us to see nutrition as workers' rights, these key stakeholders are important. The government, the researcher organization, employers, and workers and labor union. First of all, the government is very critical, as the government shapes the national policy and regulates anything related to nutrition and workforce and public financing. And researchers like the WageIndicators and other research institutions should continue tracking the integration of worker nutrition into policies, as well as evidence on the impact it has on health. And for organizations such as the Workforce Nutrition Alliance, who is there available to support organizations that are willing to implement workforce nutrition, and of course are always interested in raising awareness about how workforce nutrition is very important. And for employers, seeing the benefits of workforce nutrition when it comes to the productivity, high retention rates, and increased contributing to the macroeconomy, the employers are being called to integrate and invest in workforce nutrition. And lastly, the workers and labor unions, whose voices, of course, are always needed every now and then, and also for them to participate whenever there is any program design in the institutions. So with that, we can further strengthen and recognize nutrition as part of workers' rights. Yes. Yeah, we also see that nutrition is sitting at the center of decent work, which is beneficial to all, beneficial to the employer, to the employee, as well as the government at large. Nutrition, when the workers embrace good nutrition or workplace nutrition, there's increased better energy to work, less fatigue, and as well, of course, improved health. When a nourished worker, there's this evidence that says that well-nourished workers, of course, gives to increase better performance and increased productivity. With workforce nutrition, you can see that it helps to reduce the healthcare costs, improve the productivity, as well as increase progress on the Sustainable Development Goals. And we are seeing nutrition at work as a thing of dignity and fairness. And we see that incentives, the it's important for employers to prioritize and incentivize workforce nutrition because it has a high return, a huge return on investment, as well as improving the human capital. And not just that, it also have a way of positioning the workers or the employers to boost their reputation. It helps them to meet their environment, sustainability, and governance goal. So with that, we see that nutrition is very important, and we are calling different organizations to implement and scale the workforce nutrition. And the first place they can start by is by focusing on their collective bargaining agreements in their organization. Next. Okay, so we have, like I said before, Workforce Nutrition Alliance is an organization that is there to provide both technical support and handhold organizations, different employers to implement workforce nutrition. And this is our website. You can get more information, tools that can help you effectively implement workforce nutrition in your workplaces. Yeah. Yes. Yeah. Oh, thank you. That's all from us. And Lina, over to you.
Thank you for the excellent presentation, Naila and Christina. Really loved listening to you. We have started receiving questions in the chat section, but I can also request them, Fiona and Della, if you would like to unmute yourself and ask. I think these are very relevant questions. And also, starting us off, we expect more questions. Fiona, would you like to unmute yourself?
Sure.
Yeah.
Thanks a lot, team, for this super insightful presentation. And I'm very keen to learn a bit more about how we can improve the coding system of our current coding systems of the CBA database, but also for the future, right? So so I have basically two questions in one. One is, do you have recommendations on how we can better capture all the topics on nutrition in CBAs that might be there now, but that we haven't captured because of the way that we interpret it, right? So that's question number one. And then the other question is linked to that in terms of for when the keywords were not there. Is that because you think they were not mentioned in the CBAs, or because the coding system is not up to date with that? So that's, yeah. So like, how do we improve it? Also, as such that people know how to use these type of words when they want to negotiate on this topic more, right, in the future, like what was just shared in the recommendations.
Yeah, thank you, Fiona, for your questions. I think it's a really good question. So for the wage indicator, it is a pre-coded variables. So they already have a listed of variables that they coded, but unfortunately, not every pillars of our for workforce nutrition is available explicitly. So for example, like nutrition here, if you see like nutrition, balanced meal, and balanced diet, it's not available in the wage indicator variables, but we can find another related keywords such as meal allowance, but it is not direct nutrition reference. So that's the difference. So I think like yeah, to really improve like for the recommendation to really improve like how we better capture nutrition among CBAs for specifically for the database, I think it's also to expand the keywords that or like the coding that related to nutrition itself. And so for the difference between the wage indicator, LaGiFrance, and US OPM, it is located because wage indicator is pre-coded variable analysis. So they basically already read through and annotate everything. But for the LaGiFrance and US OPM, we relied to the keyword search. So we pre-identified the keywords that are related to each pillars, both the direct and indirect. And we check whether there is CBAs that mention specific keywords for each. So for example, here, like in nutrition, in balanced meal and balanced diet, no CBAs in US OPM database that mention balanced meal and balanced diet. They probably mention it without us knowing because maybe they use another terms or keywords, but we cannot 100% sure about how they integrated it because we solely based on the keyword search. So that's one of our limitations for the study. And also for the breastfeeding break paid, for example, we cannot see whether it is already integrated or not in LagiFrance and US OPM, again because of the keyword search. In LagiFrance itself, I think it is more than 20,000 CBAs there. So within like the limited time, we cannot really read through everything and check whether they mentioned about breastfeeding break paid. So we don't use that, but I think it is a recommendation for future research to maximize it. Yeah, I hope it's answering. Or if there's any feedback, Fiona?
No, great. I was saying in the chat that it's for now a limitation of the study, but an opportunity for us
Yes.
to improve the coding.
Yeah. Yes. Thank you.
Thanks.
I
We
think,
have,
Lina,
sorry.
sorry to jump in, just
Yeah.
to add to what Naila has mentioned. I think we on the Workforce Nutrition Alliance's website, we have already have like the pillars. We have the key terms that Wage Indicator can look at, and if they want to, they can focus on integrating the keywords from there to pre-code. Yeah. But the platform, the website is up and running for you to have access to the frameworks that guides our implementation.
Thank you. And I think these are helpful in the sense while we are coding, right? It's always good to hear different perspectives in terms of understanding what are the keywords that we should look for. Even what you bring out in the paper is like a 0-1 mention of just saying they had meals, or what were they saying about meals other than the fact that people should have meals? Even then they're coded as one, right? Saying, okay, they mentioned meals. So I think these intricacies really get into play. But I have a question here from Della, and then there are more questions, which is great. Della, would you like to unmute yourself?
Yes, Lena, thank you. Hello, I'm Della from WageIndicator in Indonesia. Like my chat, yeah, I think it's fruitful finding from Gain because I'm here with the annotator of the CBA in Indonesia. Here, Andina. In chat, Andina also said that when Lina asked us, how about the CBA on nutrition in Indonesia? We only can find about the clause on extra fooding while overtime. So we don't think that like what Gain give us today about the indirect meal. Yeah, it's yeah, for me it's another view that open up our mind. And I would like to know, uh, it is about the occupational safety and health from Gain perspective. Is it also can be included in indirect nutrition reference? This questions just came up to me while I'm thinking about the crossing, about the health educational, about the health checks. So many, it is especially after COVID, many CBAs in Indonesia, there is a clause on medical checkup, MCU. So yeah, so they always, and we annotate it as the part uh, of the occupational safety and health, but I think it can be also we can see it as uh, indirect nutrition reference. But I don't know. What about this from Gen perspective? Thank you.
Yeah, I think it's really good findings that after COVID, it is increasing like the awareness to include like the medical checkups. I think it's also aligned with our interest research as well, because actually like for the nutrition focused health check, uh, is include medical checkup is also included. But why we put it like indirect nutrition related provisions is also because health check doesn't mean that it is related to nutrition. It could be like related to health, but not specifically to nutrition. That's why we put it on the indirect one. But if the health check maybe included some of the indicators or biomarkers that are related to nutrition, such as like diabetes, that is very related to nutrition, right? Because of the sugar consumptions and something like that. So that's why like we differentiate between the direct and the indirect one. But I think it is, I mean, if we want, if you want to expand it a little bit more and more specifically to nutrition, I think what will be helpful is we differentiate it that way. So we differentiate so the direct one is the one that is really related to nutrition, such as like I said before, like maybe something related to diabetes or like blood cholesterol level or biomarkers that are related to nutrition. But for the indirect one, health check and medical checkup, it's also included. So yeah, I think that's that's what I can reply there. Is there any addition maybe from Christina or Chioma? Or if there's any feedback from Della?
Yeah, I would just agree with you. I mean, I think, and you're closer to the coding, Nyla, and I think a number of people on this call. It doesn't strike me that any of the coding is the problem, right? I think the problem here is that it's not recognized. Nutrition is not really recognized as an issue in and of itself. So there's any references that are related tend to be mostly indirect because things like meals, maternity leave, well, maternity leave we know is mandated, right, in a lot of countries. So that is a negotiated topic. But things like meals are important for workers because they're a benefit. They're often like, like almost an addition to a wage. But they're appreciated because of, it's kind of, it's because it's caloric and filling, and it's important for people, especially low wage workers, to fill their bellies and feel like they're not suffering from hunger, but actually it's nutrition and the quality of those meals that we're really most concerned about, and those don't seem to arise in any of the CBAs. And we would pose back to you all who work closer in this, like what can we at GAIN do, and how can you help us raise this topic so that even workers are aware that it's not just a meal, but it's the quality of their meal that's really important and most beneficial for them. Thanks.
Very interesting. I'm loving this
Yes.
discussion. I see two questions, and maybe you can just take them. So one is from Gregory, who asks, "Does GAIN operate in South Africa?"
Thanks for the question, Gregory. We're not in South Africa, but we've been working on workforce programs for about 10 years at GAIN, and we have a lot of kind of collaborations and partners, and we have worked with some companies and through the University of Pretoria in providing support for workforce nutrition. So we don't have presence there, but certainly partnerships. So please do feel free to reach out if you think that we can kind of find some collaboration or way to support you in your work there. Yeah, thanks.
So, Gregory, that's for you. And I think it's good to have webinars like these, right? In the sense we find the other people who are also thinking about this topic in different contexts. There's a question from Kea, and I know you also discussed this in the paper. Do you have keywords in multiple languages? And how did you actually tackle the language barrier, translation, and ensuring that all the words were searched for?
Yeah. Thank you. I think it is important questions. So for the US OPM, we're glad because the local language is English, so we don't need like any translations for that. But we develop for the keywords. We develop it in English. So we have several bunch of keywords that are related to all the pillars, and we conducted it in English. But for Legifrance, because it is with French. So we ask our colleague that's fluent in French to check for the keywords, and also she recommend us the options just in case one keywords is not is not showing like the result. So we have several keywords for a specific language. So I think like to tackle the language barrier, I think basically we ask if we have a colleague that fluent in that language. So for example, in-depth analysis for the CBAs, the qualitative one. So we also ask people from Bangladesh to have it translated. Actually, we already translated using a DeepL, but to dig more like a contextual understanding, we ask people from Bangladesh to really read it through and check whether it is right or wrong, or like our interpretation is right, so something like that. Yeah.
There's also another follow-up question. Kia, may I request you to unmute yourself? And this is also Professor Kia Titans from Wage Indicator. You have also referred to her past work on CBS in your paper.
Yeah, can you see me?
Yes, Kia, we can see and hear you.
Okay, yes. Within collective bargaining, there is overall both parties at the bargaining table prefer extra wages over extra meals. So full stop. That is what it is. So when you search for meals in collective bargaining, it's a picture that is not fully representative, because part of it may be reflected by extra wages. That's it, my response.
Yeah. That's really interesting. And from your perspective, I mean, I think that's what we understand as well, is that, you know, at least with where we've been engaged in the garment industry and the tea industry, people do prefer wages, of course, and be able to make their own decisions and have more money in the pocket. But I guess there are industries where meal provision is mandated, right? Because the worker population is either far away from a place where they can access meals, like in mining companies or shipping companies, things like that. And then for sure, because it's also mandated, they will be there and it's not kind of negotiable. But do you have any suggestions for us on how, you know, I don't think we're going to reverse the tide on workers requesting meals if they're nutritious instead of wages. People always prefer wages, but where there is room for improving upon the quality of meals in CBAs, we would really love suggestions. Even, you know, we don't necessarily work directly with kind of legal instruments. So, you know, we're more kind of advocacy and support, but we really, well, we look forward to collaboration and advocacy from you all as well. But please let us know if there's anything that we can do to kind of address this issue of nutrition, and how we can kind of improve, I think, worker awareness too around how important it is for them to get not just a meal, but a nutritious meal.
Yeah. Yes, so basically employers in most cases will provide a canteen to the workers. And so in collective bargaining, there could be recommendations or clauses related to healthy food in the canteen. And most CBAs also have clauses in case of overtime work, because then also the employer is requested to provide a meal in between, you know, before overtime work starts. So in all these cases, there could be clauses on not only a meal, but a nutritious meal. So, yeah.
And even where the meal is not provided for free, right? Like more a cafeteria, where at least where things are offered and workers can purchase the food, but that there are healthy food options there.
Yeah, that's for sure. And that could be agreed in collective agreements.
Okay.
Yes.
Great. Thank you.
Yes, Fiona.
Yeah, I have another question, maybe also to the GAIN team on where do you see this conversation headed? For example, with union strategies on this topic, is this a topic that, and what is the role of GAIN in pushing this topic further also within CBAs, if this is not a topic yet that's taken up by trade unions?
Thanks. Well, I think that's a lot of why we're here in this conversation also, is to get ideas from you. Because to be quite frank, I think we've had the most success working with business associations and from the employer angle, as well as with governments and policies and our engagement with ILO and ministries of labor in countries. But I think where we've had the least success and where it's a little bit less, the entry point is less easy, is through unions and through the worker angle. So yeah, I think, we look forward to your recommendations on how to go about doing that, because it's kind of our next step. And yeah, I think we've worked, I think in Indonesia, we've had some success with some labor unions there, but it's still just beginning. Yeah, Choma, I don't know if you want to add to that.
I just want to agree with your point that we are also looking for how or opportunities, how to influence or how to connect more with labor unions, because we have achieved great success in our policy work with the government across different countries. We are in about 12 countries. We have achieved great success there. But the union is somewhere that with your perhaps your insights, we can maybe chart a better way forward.
Thank you. And I think these are all conversation starters, right? These are all deep conversations about the economic trade-offs. Should you pay or should you provide food? And whose problem is it if the workers fall sick? Is it on the employers? And that's why they are more interested in this. And workers want wages because they can make that decision. What does high calorie food mean? Or should you just pay and make them let them make the choices? What are the words that ideally should be included in CBAs, which will finally result in better nutrition and healthier workforce? Or is just the 0 1 variable enough? Right? So these are also in terms of the quality of what is included, what is bargained. Or for example, if it's not bargained and still happening in reality, because these are the areas where they have to provide food, for example, the sectors that you have chosen, and then there is nothing around outside the workplace. So yes, these are super interesting questions, and I hope you continue working and we continue working together to explore these questions in detail. You also write in your paper that about future research possibilities and some of the regression analysis to figure out what is causing inclusion in some areas and what is not. If you have more thoughts, I would love to hear them. And the other one, okay, maybe I'll actually let you answer this one before I move to the other one.
Sorry, can you repeat the question again? I didn't catch
Yes.
the last.
So in your paper, you have mentioned like for future research, we need to move into more regression analysis beyond the binary coding of whether it's present or not. Do you have something specific in your mind?
Yeah, so actually, before the one that we already have, the one that WageIndicator has is actually, did you already provision meal breaks, for example? Yes or no? But we need like the rigorous detail about like, okay, if it's already there, how is it implemented? Is it like already healthy enough or is it not? So that specific, recommendation that we want to explore more.
Okay, I think so. What you are saying in principle is moving towards the whole statement analysis
Yes.
rather than
Yes.
just saying about the presence.
Yeah.
Kea also has a point on chat, but Christina, yes, over to you.
No, I just wanted to say, I mean, I think if there were more CBAs that included nutrition, then we could do more, I think, with regression analyses and look at like what are the contexts and what are the industries and sectors and countries where it really emerges more. and do a little bit more analysis there. But I think our overall take-home message is it's just not there, right? It's just not there enough. It's very rare. Obviously, there's a lot of room here to improve awareness around nutrition and not just food, and the importance of the distinction there. Yeah.
I
And I
agree. And
love,
yeah, sorry.
no, go ahead.
I think you also mentioned in your paper, right? So sometimes for overtime clauses, that's where the concept of meals are mentioned, which may be, I don't know if it's linked to saying food is something you do after work, and only if you stay for longer, it's on us, right? So these kind of conversation is always good to know how this conversation started and how it ended. That's a whole research project, I can think. So if you are writing research proposals, please let us know. I think we would love to explore these questions together, right? Because both of us want to know how this is happening. What are the implications, for example, if someone includes canteen, providing vouchers, as you were saying, it can be free, it can be paid, and then who essentially ends up buying, right?
Mm-hmm.
Or if for countries where you want to bring your own tiffin and then you don't want a employer provision of food. So this is something for us, and Kia actually has written on chat that Wage Indicator has a series best clauses in CBAs on a specific topic. We could propose for an item in the series regarding healthy food. I agree, and these are all feedback, and I think you also have more clauses on your website, as you said. Overall, it was a very interesting read of your paper, and I really enjoyed listening to you as well. So thank you for being with us. Do we have more questions from the audience? I'll just quickly see.
I just wanted to jump in on one of I know there's a lot of discussion or questions about living wages, and I know that you all do a lot of work with living wages, and just to say that early on, I think through IDH and the anchor methodology for living wages, we were really happy to see that actually the concept of living wages and the calculations include not just, what are the wages that are needed to buy food, but also to buy healthy food. And so that was really nice, at least from Gain's perspective, to see that in kind of the living wage work. Just wanted to make that comment.
Just to say, Christina, I agree. And within Wage Indicator's methodology on living wages, we have this too. So we include a healthy diet, or even more so, healthy and nutritious diet, which also includes local specificities on what that is. As such, it is also accessible. So it's a healthy, accessible, and nutritious diet, or accessible, healthy, and nutritious diet, I would say.
Yeah, fantastic. Great.
This only shows that we are all thinking across the same line, and this is for the audience. So the study that they presented today, right? So the scoping term was April to July 2025, and this is July 2026. So we have come like one whole year round. I also want to maybe end with this thing that you said after COVID, health has become more of a focus, and maybe over time you expect CBAs to include more on health checkups. But do you still see inclusion of nutrients or micronutrients in clauses? And just a leaving message on what do you think we all can do together collaboratively to make it happen for a healthier workforce?
Well, maybe I'll just quickly comment on the health checks. I mean, I don't know. This was a one-time deep dive into the CBAs, but maybe if we repeat the study and see if there's been an increase in kind of in a year or two, to see if there's an increase in health checks emerging, that would be really interesting. And I think what we've learned also, at least from the nutrition community post-COVID, is that underlying dietary factors and nutritional status was such an important risk factor for COVID disease progression. We're always surprised that nutrition has not emerged more and more as such an important topic, but we're getting there. And yeah, I love these kind of conversations that we have with folks from different sectors and how we can work together on kind of mutual work. So I think this is just the beginning of conversations. Thank you so much.
I love the fact that we are ending this webinar by saying that this is a beginning of the conversation, and I really hope we keep in touch. So I'm really grateful to the people who have joined our webinar today, and I hope you continue this wonderful work. We have feedback for ourselves in terms of coding, we'll look more into which clauses we can include. And yes, let's also start seeing the changes over time and countries, and if we need a pandemic to really change CBS in this world, right? So thank you again, everyone, for coming here. If you want, we can click a picture for saying hello to the rest of the world, saying we are having this conversation, join us. Valeria, do we do this?
Yes.
Okay, so should I maybe unpin ourselves and then have it with the whole team?
Yes, please.
Yeah. Wait, but I think you'll have to unpin me because I can't unpin myself. I can only pin myself. Yes, thanks.
Bye-bye. Thank you. Bye-bye. Thanks.
We'll just click a picture with the team. So if you're comfortable having your video, just have your video on. Okay. Everyone, say cheese. Okay. Thank you so much then, and let's stay in touch.
Thanks, everyone.
Thanks a lot, team.
Thanks
One
a lot.
final thing while we say goodbye, but we're updating our backend system for the CBAs at the moment also, so we can include a lot more of these smaller clauses from France and stuff like that. So ideally, we actually do this research again together in a year or so, and then hopefully we can actually do this analysis for like 30,000 CBAs or something, right?
Great.
40, 50, let's
Great.
go.
Can I add something still? We're not finished yet, I think. For the data collectors, we can ask many data collectors around the world how they find nutritious food. Because now, so they collect data or prices for, let's say, cheap, super cheap, and more expensive food, but we can ask them how they find it. Because that is, let's say, the proof in the pudding is the eating. So such an interview with a couple of data collectors would be good. And I think, where was Guide? He was here still. So
He left.
I will ask.
Yes. I think there's a lot of scope to do. And I also figure clauses like breastfeeding and parental leave come more often because these are some things that people think about. Nutrition, micronutrients are actually sometimes cognitively harder to think about in reality, like what it means, what to write, how to bargain.
Exactly.
Could be a reason why it's not specified, right? Because these are harder things to think.
Yeah.
Okay, then let's continue this research. And let's have a
Yes.
webinar again in 1 year's time.
Thanks, everyone.
Thank you so much.
Thank you.
Bye-bye.
Thanks, everybody. Have a good day. Bye-bye.
Bye.